Stress and stress management. Welcome to this session on stress and stress management techniques. The focus of this session is to understand how stress and people's responses to stress influence health. The earlier parts of this module have explained the difference between disease and emotional well-being. In this session, we will delve into the relationship between stress, mental health, and disease, and examine relaxation techniques as a key part of therapeutic treatment for a range of issues. By the end of the session, learners will understand what stress is and how chronic stress influences disease. Learners will also understand how stress is linked to mental illness and lifestyle. Lastly, the session will explore a range of stress management techniques, highlighting their core principles and how they influence mental health, stress, and disease. Mental illness relates to various disorders including psychosis, anxiety, depression, OCD, and ADHD. 1 in 4 people will experience mental health issues every year, and many more go unacknowledged. 30% of those with a chronic health condition will have depression, and there tends to be a clustering of mental health issues in those with health conditions. Signs may include tiredness, feeling sad, feelings of impending doom, loss of interest in usual activities, and feelings of hopelessness. Many lifestyle choices are as potent as antidepressants, but they are often a neglected aspect of therapy. Diet, sleep, exercise, relaxation, and abstaining from using substances can also impact mental health through increased self-esteem, mood, and feelings of control. Established mental illness is on the disease end of the well-being continuum. In truth, our well-being is challenged daily through a range of stresses and our responses to these stressors. Should we not address these and lack the awareness and skills to confront these, chronic stress can lead to the development of these disorders. The role of the health coach is to increase a client's awareness of their stressors. Look to support a positive mindset when dealing with stress, and consider behaviors that may decrease the impact of the stress. Stress is our body's response to a stimulus. Psychological stress refers to our brain's appraisal of certain situations or pressures and our subsequent physiological responses to these. Our previous experiences build up a bank of assumptions and reactions to situations. This was useful in evolutionary terms to keep us safe and avoid threats to our health. Nowadays, however, the constant bombardment of stressful situations means our capacity to manage the stress response is under strain. Stress responses, in evolutionary terms, were usually followed by a period of revitalization and recovery. In modern society, the lack of opportunity for this respite means many people are on a dangerous path to burnout and chronic stress, which is linked to mental health disorders and chronic disease. The stress response is triggered when we feel we are under threat and do not have the resources to deal with a situation. Importantly, this can be in a circumstance where we previously observed when we did not cope well, or due to repeated exposure to stress when our ability to deal with the stress is drained. So, if a situation is sensed as a stressful one, it means sensory information has been fed into our brains and cross-checked with our memories, which signals an alarm, and we get a cascade of physiological changes. The hypothalamus in the base of the brain is activated, which oversees the pituitary gland and the adrenal medulla. This produces the short-term responses associated with the fight-or-flight phenomena, which include increased heart rate, increased blood pressure, the release of hormones to mobilize energy into the body, a decrease in immunity, and a shunt of blood into the working muscles. The often silent low-grade chronic stress has many clinical implications. The constant activation of the stress response and perceived higher levels of stress are associated with heart disease, mental health issues, metabolic issues, reproductive issues, and personality development issues, which are linked to many chronic diseases. When the balance of the body is disrupted, the disharmony leads to biological shifts, leading to changes in normal bodily function. Importantly, how we respond to stressors, intervene in the bombardment of stressors, and act in relation to lifestyle choices can create an antidote to this dysregulation of our chemical response and interrupt the development of mental and physical illnesses. In order to counteract the chemical disruption stress causes, it requires a complex repertoire of behavioral and physiological responses, known as the adaptive stress response. The ability to develop this adaptive stress response will be based on genetic, environmental, and developmental factors. However, the goal for the health coach is to support the client to manage the perceptions of situations to decrease the magnitude of the stress response. In addition, the coach should look to support the adoption of practices to stimulate the opposing physiological reactions to the stress response to induce recovery and protection against disease. Lastly, the coach should work with the client to preempt and plan for stressful situations to decrease the load of stressors in their life. On another note, physiological stress is only one contributing factor that leads to the cascade of neurological and metabolic issues. A Western-style diet is a different type of stress that the body has to deal with, which leads to inflammation and challenges to a healthy body and mind. Interestingly, exercise is a stressor and leads to a similar response to physiological stress. However, the type and intensity are important factors that will determine the stress load. In addition, exercise increases our resilience to the stress response, decreasing the impact of the chemical change on our disease risk. Sleep, diet, and exercise are inextricably linked to each other and all impact the same pathways which are known to lead to mental and physical ailments. Remember that the stress response is triggered when our brains, based on previous memories and experiences, will highlight if a situation is threatening. One important area to note is the role of our unconscious responses to situations. The role of a coach is to support people to question unhelpful thinking in daily tasks to strengthen their resolve when stress occurs. By reframing situations in a positive light, it decreases the activation of the stress responses. Interesting research has shown that people's perceptions of stress are a strong predictor of health outcomes. In other words, those who view stress as being energizing, giving focus, and increasing productivity tend to have better outcomes than those who view stress as debilitating. Even more interesting is that the level of actual stress and demand does not change this relationship. In other words, if you see stress as a positive part of your life, the level of actual stress does not seem to matter. However, this is not to say we should all be overworked. On the contrary, you need to provide the body and mind with the opportunity to recover and reload the reserves to deal with stress. However, it does show that the perceptions of stress have a direct impact on the body's response to situations. During the rest of the module, we will explore the second goal when supporting clients with stress management. This is the role of trying to rebalance the body's physiological disruption. Interestingly, many relaxation strategies have also been shown to have a knock-on impact on how we respond to and view stressful situations, meaning these approaches can target two of the three goals of developing an adaptive stress system. Relaxation techniques refer to a broad range of approaches with the aim to reduce stress and enhance emotional well-being. Relaxation techniques influence the relaxation response and can counteract the stress response, including chronic increases in anxiety, blood pressure, and heart rate. Some approaches may include a spiritual element, but this is not essential. Many also involve breath work and subtle or explicit forms of meditation. We now turn our attention to some strategies and explore their core principles and roles in stress management. With all the below approaches, preparation is important. Encourage your clients to set up space for themselves, plan self-care time, find a comfortable position, and eliminate any distractions. Also, it must be clear that there is no wrong practice when engaging in these strategies. Like anything, stress management is a skill and requires practice. People can become frustrated and feel like they are doing it wrong if their mind wanders. Yet, every bout of relaxation supports the development of the skills needed to counteract stress. Breath work is a practical tool that can be applied anywhere. 2 to 3 minutes of focused breath work can interrupt the sympathetic drive and decrease the stress response. Engaging in breath work creates the time to induce relaxation, which decreases the body's opportunity to remain in a stress state. Breathwork involves focusing on your breathing and trying to eliminate all other mental distractions. The process involves bringing attention to the breath and then making a conscious decision to slow your inhalation and exhalation. This can disengage your mind from the thoughts and sensations that are stressful. The actual amount and timing of the practice is up to you. Working up to 15 to 20 minutes a day is often recommended. The proactive approach helps with emotional regulation and the ability to increase your awareness of stressful situations and counteract the symptoms of stress. Body scanning combines breath work with progressive muscle relaxation. Stress can also induce muscular tension, which can over time lead to muscular imbalances, injury, and chronic pain. After a brief period of breath work, you bring your attention to one part of the body. Although different protocols exist, the aim is to then make a concentrated effort to reduce tension in the area and try and relax the muscles. Some approaches ask you to tense the muscle first and then relax, while others ask you to just recognize the tension in the muscles. This is usually followed by a progressive movement up or down the body. For example, you might start in your feet and move to your calves and up to your legs, respectively. Yoga, Tai Chi, and other forms of movement relaxation techniques are an ancient combination of strength, flexibility, rhythmic breathing, and balance work. Traditionally, there is an emphasis on self-care and the power of relaxation for spiritual means. The focus of movement and breath work strengthens the relaxation response and emotional regulation of stressful situations. Guided imagery or visualization takes a different approach to stress management. In other approaches, there is a requirement to eliminate your thoughts and distractions to focus on the present moment. With guided imagery, you use the mind as the tool to distract you from your automatic emotional responses that the daily stressors may be causing. In guided imagery, you transport yourself using your mind to soothing scenes, places, and memories to focus your attention on pleasant experiences. This can improve optimism and a sense of life satisfaction and can decrease the feeling of strain and hopelessness. Mindfulness is a very popular stress management approach, where a state of mindfulness is defined as living in the present moment, paying close attention to your experiences, thoughts, and emotions in a non-judgmental way. The idea is to be kind to yourself and increase your awareness of how your mind works on a moment-by-moment basis, compassionately accepting yourself. The goal is to recognize responses to situations and develop new positive adaptations in how you respond. In contrast to other relaxation techniques, the goal is not to suppress your thoughts and mind wandering, but to pay attention to them so you can learn about yourself. Mindfulness can be combined with other approaches like acceptance commitment therapy or approaches like body scanning, or it can be used as a standalone approach. The practice of mindfulness is diverse, and it is important to find an approach that suits you. People can engage in mindful walking or running, candle gazing, and more traditional body scanning, for example. Daily tasks like washing up, cleaning, or driving also offer the opportunity to engage in mindfulness. Regardless of the approach, mindfulness should follow some basic principles. Firstly, it is a form of meditation, and as such, it should be purposeful, structured, and focused on self-awareness. Mindfulness has a particular emphasis on trying to remain in the present moment and being aware of how you feel and think. Lastly, mindfulness is about acknowledging our thoughts and being kind to yourself, as opposed to berating yourself. Therefore, it asks us to be curious, open, and accepting. Mindfulness now has good evidence in the field of anxiety, depression, pain, and anger management. The central mechanisms of effectiveness may be the ability to disengage with a current way of thinking and feelings and replace them with greater clarity on who you want to be. As stated, the range of stress management approaches seems to influence the relaxation response as a way to counteract the stress response and subsequent health issues. However, as noted, they may also spill over into emotional development, changes in identity, and resilience. Stress management approaches may directly decrease mental health symptoms, increase motivation, support the ability to change lifestyle choices, and alter the biological impact on health by changing the pathways related to nervous, hormonal, and immune systems. As immediate intervention health coaches, we should consider working with clients to increase their awareness of their stress-inducing situations and look to build in practices that decrease the stress response and improve personal tolerance and awareness of stress and its impact on well-being. In conclusion, stress is an important factor to explore with your clients, as it is deeply rooted in emotional well-being, lifestyle choices, and chronic disease. Stress relates to our response to situations where we feel under pressure and threatened. This is based on our level of exposure to stress, but mainly from our previous experiences and ingrained beliefs and assumptions. The response when our brain indicates a dangerous situation involves a cascade of nervous, hormonal, cardiovascular, and immune system responses to prime us for action. The chronic activation of the stress response leads to numerous issues with physical and mental health due to the chemical disruption this causes. The adaptive system needed to counteract this response has 3 goals. Firstly, we should look to reframe and modify how we respond to situations to mitigate the activation of the stress response. Secondly, we should engage in activities to counteract the stress response, activate the relaxation response, and reverse the disruption stress causes to our physiology. Lastly, we should plan to protect ourselves from an overload of stress by prioritizing self-care and problem solving. Stress management approaches are a broad menu of tools that can help with how we view stressful situations and induce the relaxation recovery processes. Relaxation techniques and mindfulness offer core principles that should guide your work with clients to tailor their adoption of practices to enhance their health and well-being.